welcome. My name is Alessandra Schneider. I am a Senior Program Manager at the International Step-by-Step Association, and I will facilitate this webinar. We are meeting for the 7th time under the Health Systems for Early Child Development, a joint initiative led by the UNICEF Regional Office for Europe and Central Asia, the World Health Organization Regional Office for Europe, and the International Step-by-Step Association. Before starting, I want to share some technical information. Translation into Bosnian, Croatian, Montenegrin, and Serbian and Russian are available. Please choose your preferred language by clicking at the interpretation box at the bottom of the Zoom page. Remember to write your questions or comments in the Q&A or chat box, and you can do that during the presentations. Today, we will learn and discuss key topics related to the mental health and well-being of children and parents. Additionally, the UNICEF's vision for elevating parenting and two related packages will be presented. And so this is our full agenda. We are privileged to have in the opening session two distinguished colleagues, Dr. Gabrielle Fontana, UNICEF Regional Advisor for Health at the Regional Office for Europe and Central Asia, and Ms. Zorica Triket, Senior Program Manager at the International Step-by-Step Association. Dr. Gabrielle, the floor is yours.
Thank you so much, Alessandra. Just a nod to make sure that you can hear me. Thank you. You know, with technology, you can never trust it. The honor is and the privilege is mine. Dear colleagues, it's a pleasure being here with you virtually today to reflect together on how parenting can be instrumental for the well-being of children, and today with a focus on mental and psychological well-being. When it comes to early childhood development, we have developed during the years comprehensive approaches, ECD, that encompass timely health services, healthy feeding, early schooling, and the most challenging element remains parenting. Parents are human beings. I know because I'm one of them. We have our skills, but we also have our struggles and limitations. And at the same time, parents are the main resource for every child. Supporting parents is the best way we have to support young children. Parenting doesn't always come easy. It's a learned set of skills, and it differs for every child. And when parents or young children experience mental health or psychological challenges, then parenting reaches a whole other level of complexity. While over 250 million children and adolescents experience mental health conditions due to stigma and lack of services, many go undiagnosed and untreated. Half of mental health conditions are diagnosed by age 14. Supporting mental health and psychological well-being of young children requires responsive, loving relationships, stimulation, and care to ensure that developmental and emotional milestones are reached. Even in normal circumstances, without adequate support measures, caregivers can become stressed, overworked, and be forced to make difficult compromises that jeopardize their mental health and the developmental well-being of the child. On top of that, 1 in 14 children has a caregiver with poor mental health. And these children are more likely to have poor general health, mental, emotional, or developmental disabilities, to have adverse childhood experiences, such as exposure to violence or family disruptions, including divorce, and to be living in poverty. It becomes clear then how parents need support to provide adequate care for children's development and their own mental health and well-being. In the next hour and a half, we will be discussing exactly that. with a very interesting presentation from Professor Oberkleid. I saw the recording and the experience shared is really insightful. Some perspectives from our own Eva, from UNICEF, on how to elevate parenting in the national agenda, and an overview to a couple of tools that can be used to make a difference in practice, BEBO and caring for caregivers. Now, from the UNICEF side, working with WHO and ESA and other partners, we're committed to help national partners to incorporate or to parenting interventions into broader public health strategies and to improve availability of targeted and intense programs for the most vulnerable families. Let's keep working together to advocate for cost-effective services that support parenting and give children the best possible chances to succeed in life. I wish all of us a stimulating and interesting webinar, and even more, great success in the work ahead to make a difference for children. Thank you so much, and over to Sarika.
Thank you, Gabriele. Thank you. So, a warm welcome to everyone from ISA, and it's a great honor to host this webinar in partnership with UNICEF ECHO and WHO Europe under one of my favorite initiatives, Health for Early Child Development. The webinar tackles a very important topic: how can we design and implement parenting support interventions aiming to strengthen the mental health and well-being of young children and their primary caregivers. It is of great importance to open this dialogue about mental health and well-being and try to deconstruct stigma and biases connected with, I'm sorry, something is happening with my battery, stigma and biases connected with this issue. Science tells us about optimal child development. You know, we are all familiar with the nurturing care framework, and we all know that that for optimal child development, children need caring and inspiring, caring and safe nurturing environment, plus responsive parenting. And how child well-being is directly connected with well-being of the caregivers. There is also a lot of evidence showing how traumatic early childhood experiences, such emotional neglect or abusive relationships or harsh discipline or any kind of harsh parenting style which is not compatible with what child needs and how child behaves, how all these factors negatively impact children's mental health and well-being. And still, we do not talk enough what we have and what we can do. In our network, in the ISA network, we believe that as professionals, we have a huge responsibility to support parents, not to educate them, not to tell them what to do, but to support and guide them to become the best version of caregivers. Those who instill love instead of fear, those who have patience, those who are open and respectful in communication instead of introducing punitive measures and directives. Parents who understand, know, and accept their child. To achieve that, we must see parents as partners, and we must put them and their children in the center, in the focus of our programs, services, and interventions. As Gabriele said, we have to give them space to take risks, to make mistakes, and to learn together with us from those mistakes. It is critical that parents feel respected and supported. And one of the powerful ways that we learned in our network is to really see them as partners, to be empathetic to their needs and interests and respectful for their solutions and ideas. This requires a workforce that is trained uh, and which manage to gain new knowledge and skills as well as, let's say, new way of understanding what parenting is about and what support for parents means. These new skills and knowledge include active listening, observations without diagnosis and labeling, dialogic communication, strength-based approach, and how to engage in responsive interactions with parents. When frontline workers treat parents without biases, when they pay attention to their needs and follow their led-on conversation by asking open-ended questions and relate to parents' concerns, that's the moment when parents really feel supported and respected, and when they grow the most. This experience also helps them to engage in meaningful and responsive interactions with their children too. It works like a chain of positive and supportive human relationships uh, in which we are all involved. Supporting parents for nurturing care resource modules package for home visitors that ISA developed together with UNICEF ECHARO address most of these topics, including the well-being of caregivers and its impact on child well-being. And my colleagues are going to put the link to the modules in the chat box. But before I close my speech, I would like to say that care for mental health and well-being of frontline workers should also be mentioned because they play critical role. They are in supporting children and parents. In partnership with World Child Holland and AMNA and support from UNICEF and other partners, ISA recently developed a foundational training on psychological first aid and trauma-informed practices with young children and their caregivers. And this package includes guidelines for self-care for professionals and primary caregivers. To be able to take care about the others, we also need to take care about ourselves. So do not forget to do something nice for yourself today. And maybe you can start by enjoying this webinar. Thank you.
Thank you very much, Dr. Gabrielle and Zoritza, for your great opening remarks and continued support. Our keynote presentation features Professor Dr. Frank Oberklein, the co-group leader of Child Health Policy, Equity and Translation at the Murdoch Children's Research Institute, and he is an honorary professor of pediatrics at the University of Melbourne in Australia. Dr. Oberklein kindly recorded his presentation about mental health in early childhood. Shall we start?
Hello, my name is Frank Oberkleid, and I'm a developmental behavioural paediatrician from Melbourne, Australia. I've had a long policy and research and clinical interest in early childhood and in mental health, so it's nice to bring both those things together. This will be a recording. I'm not with you in real time. Due to the marvels of technology, I'll be a long way away from my computer when you're watching this. So this will be a recording, and Let's get started. I'll share my screen. So I hope you can all see that. So the first thing to say is that the language we use in child mental health is very important. And one of the reasons is that we've found, and I'm sure you found the same in your work, stigma is a very big issue for both parents and professionals. That our experience is professionals are often reluctant to raise the issue of mental health concerns with parents because of that stigma. They'll react in a negative and defensive way. We also find that the term mental health means that adults often default to mental illness. Mental health means mental illness and therefore psychiatry and therefore diagnosis and therefore drugs. So mental health isn't a good word either. And we've been struggling with the language for a long time. We've tried some alternatives like social and emotional problems, mental health and well-being, social and emotional well-being. None of them work perfectly, but in Australia, we've landed on mental health and well-being. We never say mental health without adding well-being. And that's a much more strength sort of approach, whereas mental health is so negative. But what we refer to, I think we'd all agree, are young children's problems with self-regulation. They're active, they're intense, they have a low threshold of frustration, difficulty regulating emotions, problems interacting with peers and parents. Some young children have high levels of anxiety or social withdrawal, or they'll have behavioural issues that cause challenges for parents. And not that commonly, but importantly, we see more serious problems such as autism, infant depression, and so on. We know that child mental health is very different from adult mental health. I often say child mental health is a different country completely for a number of reasons that you all know. First of all, and importantly, children are not free agents. They depend on parents to bring them to professionals for help. Adolescents and adults can just go and seek help themselves. Children are dependent. And indeed, any interventions that we organise for children are largely through their parents. Many issues that lead to child mental health issues are predictable, and these are linked to developmental stages. There are identifiable risk factors. Having risk factors does not mean that a child is going to have these problems, but it just increases the chances. But importantly, from a policy and service delivery point of view, there are countless opportunities in early childhood mental health and child mental health for prevention and for early intervention. So we've tried to develop a very different approach in Australia to mental health in early childhood. First of all, our experience is that up until recently, child mental health problems has been seen through an adult lens. And the adult lens is diagnose and treat. And that's not appropriate clearly for children. We need a strengths-based approach, not just dealing with problems. It needs to be a developmental lens that includes not just the child, but the child and family. And we need to take into account the developmental stages and the milestones in the young child that's presented to us. And I don't need to say how important family factors are. Parents may contribute to the problems, but they are also the agents of change. And as I've already said, language is terribly important. And when we're dealing with mental health and well-being issues in young children, we really do need to take account of stigma. This is Mrazek and Haggerty's very well-known chart now, this whole half wheel, if you like, from promotion, prevention, treatment, and maintenance. Whoops. And most adult mental health, in our experience, is really around this right-hand side of this half wheel. It's around treatment, diagnosis and treatment. What we're trying to do in child mental health, and these are the opportunities that we have that adult mental health doesn't have to the same extent, is focus on promotion and prevention. That with young children, we can really make a difference in moving that pendulum away from treatment towards prevention. This is a slide that I developed a number of years ago in Australia to try and make that point, that when we're talking about child mental health, it's not just focusing on mental health tertiary services. It's not psychiatry and psychologists, because there'll never be enough mental health specialists, at least in our country. We really have to move that focus from tertiary all the way through to families, primary services and secondary services. So we need to improve mental health literacy, because our research shows that many parents aren't familiar with the signs of mental health issues in their young children. So we have to improve literacy. We have to make sure that parents have ready access to well-informed primary services, nurses, doctors, preschool teachers, and so on. And part of the role of primary services is to contribute to educating parents. So we understand, I said before, that we need a developmental lens, a child and family lens to development. We all know the core concept of development, of course, that the way young children develop, the way humans develop, is shaped by this dynamic and continuous interaction between biology and experience, this transactional model of development, this dance between the genes that we're born with and our life experiences. An outcome is the result of these complex, ongoing, dynamic transactions between biology and the environment. So the child, represented here by the Constitution, evolves over time in a developmental sense, and parents, represented there by the environment, they evolve and grow as well. And the child has influences on the parents, and the parents have influences on the child. And we would define dysfunction, that is, children presenting with behavioral or mental health issues, as the abnormal outcome of this transaction. Something has gone wrong in this transaction between the child and the parents, that he or she is presented to you as having a mental health issue. We also know that you cannot separate cognitive and emotional and social and physical capacities. They're all interlinked. One affects the other. And we also know that persistent stress in that young child's environment impacts on the developing brain and increases the likelihood of these sorts of problems. And finally, we know that brain plasticity decreases over time in cognitive ability, in mental health, in any of the attributes. So it makes much more sense to try and prevent problems or intervene early. Biologically and economically, it makes so much more sense to get it right early on, to intervene early, than to wait until these problems become entrenched and then try and treat them. And this is represented in this slide by Bricker. The earlier we begin, the lower the cost and the higher the efficacy or effectiveness. The longer we wait, the cost goes up and the effectiveness goes down. And at least in our country and most other jurisdictions that I've been in, public policy is towards the right end of this continuum. The politicians and policymakers wait until problems become so severe and so common they can't ignore them anymore. Then they throw money at it at a time when it's very expensive and the evidence that we can fix those problems is pretty low. Apart from good nutrition and protection from infections and protection from injury, that is safety, the single most important determinant of the child's development is the quality of the child's relationship with parents and caregivers. So we know that when children grow up in a nurturing and responsive relationship, that builds a very strong foundation then for behavior, for learning, and for health. And of course, that's the whole rationale behind the nurturing care framework that WHO and UNICEF and the World Bank and others have developed over a number of years. We also know about risk factors in parents. This is a literature that's been around for a long time. None of these will be foreign to you. Poverty and its associations, substance abuse, mental health issues, tensions in the relationship, harsh parenting style, parental developmental issues of their own, housing, food insecurity. Indeed, any source of external stress poses a risk to parenting and therefore to the child. Now, there's no one-to-one correspondence between any of these and poor outcomes. It just increases the risk that there's going to be mental health issues. And we know from the research that any sort of adversity that impacts on the parents or caregivers has the potential to have a negative impact on brain development and act as a sort of predisposing factor or an increased vulnerability to that child presenting with mental health issues. We also know there are children's risk factors: prematurity, small for dates babies, developmental delay or physical disability, and something that I've been interested in my career, children with a difficult temperament, or indeed any temperament that's a poor fit with parental expectations and parenting style. These can all be risk factors. We also know in children there are predictable challenges based on their development. In infancy, we know that many, many infants are going to cry and have sleep problems and have unsettled behavior. And that's very challenging for a lot of parents. And that's often the very, very first sign of future problems. In the toddler, there are predictable challenges. The terrible twos, temper tantrums, oppositional behavior. We know from our clinical experience, and you do too, that many parents find this very, very difficult to control. They don't know what's happened to their infant, who's turned into this sort of monster that doesn't listen to them, that has temper tantrums if he or she doesn't get their own way. This is predictable. And then the preschooler, often oppositional behavior or difficulty with eating or sleeping, social difficulties, often with aggressive behavior or problems with self-regulation. These are all predictable stages of development. And we as health professionals working with children and families should anticipate that there may be issues around these developmental stages and be prepared to have these conversations with parents so they can have guidance and stop these predictable, normal developmental behaviors from turning into significant behavioral problems. So our approach to assessment, as I said before, we use a child development lens, which is dependent on the age and developmental stage of the child. It has to be child and family. And that's, as I said before, one of the differences between an approach to child mental health and an approach to adolescent or adult mental health. We identify child and parent risk factors, and those of you that are seeing these children and parents on a regular basis will be aware of these. Consider the use of the wellbeing continuum, the children's wellbeing continuum. I mentioned these in a couple of blogs that I've written recently that maybe you've read, and I'll talk about this in a moment. And then assess the nature of this mismatch between the children's temperament and parenting style. Parents have expectations often that the child should always be well behaved, should always do as he or she's told, should be easy to parent. And when that doesn't happen, because the child has a difficult temperament or a slow to warm up temperament, parents will find that often very challenging. And that's the first part of this cycle of dysfunction between a parenting style and the temperament or individual characteristics of the child. It's always useful to obtain information from other settings, from if the child is in childcare or preschool, ask the carer or early years professional, ask about other family settings, because that gives us important clues. If a young child is causing concerns only in the parental home, but is well behaved and causing no concerns in childcare or grandparents or in other family settings, that gives you some very important clues about the relationship between the young child and his or her parents, and provides very important insights then to guide your intervention and your guidance. And as I've said many times now, beware of stigma and focus on strengths and parenting successes. Even if you can see pretty clearly that the reason for the child's problems are difficulty with parenting, don't wade straight into giving them advice. Focus on the child rather than the parents. Here are ways we could make it easier for you to manage the child's issues. Supporting parents, I don't need to say, is just critically important. Build on the relationship that you'll have with parents, a trusting relationship. Build on that. And the use of the continuum that I'll show you in a moment opens up space for conversations with them about any concerns they have, whether they're struggling, whether they're coping, etc. And as I mentioned in the previous slide, reframe the concept of parent support. Rather than focus on parenting and its limitations, focus on the child. Explain the developmental stage that the child is at and what the young child needs to thrive. So guide the parents into making it okay for the child rather than focusing on the parenting. This is the it's been renamed now. It's not the mental health it's the child and wellbeing continuum. Healthy, coping, struggling, and unwell. It's very, very important because, as I've said a number of times, we want to get away from a diagnosis. We want to get away from deficits, from what's wrong, what's the problem, towards understanding that normal behavior is always on a continuum. There are days I feel great. There are days that I'm coping. There are other days I feel lousy. I'm really struggling, but that doesn't mean I've got a condition. For example, during COVID, you wouldn't be normal if you weren't anxious, both children and parents. And indeed, children go in and out of these various phases in the one day. So the use of this really opens up a conversation with parents. This is free and downloadable from a website. I'll get Issa to put this on a chat, and I would encourage you to download it and play around with it. We used this originally for children, but we're finding it's being used in many, many settings for parents as well. It just, as I said, opens up a space to talk to parents around, are they coping, are they struggling? Parents are much more likely to identify, yes, I'm struggling with a child, rather than self-reflecting on their parenting, or to say my child is struggling, rather than say, I'm worried my child has an anxiety disorder or autism spectrum disorder. I guess the other thing what we've tried to do is conceptually to move away from focusing only on high-risk children. That traditionally, whether it's child protection, whether it's mental health, whether it's family violence, governments have focused on the hard end, the pointy end. And their rationale is, if we've only got limited funding, we should invest it on those people that need it the most. Well, that sounds okay, but it's never worked, because there'll never be enough resources, there'll never be enough trained professionals to keep on investing in this end, and more money isn't going to do it. So what we suggest is you need a really universal approach, or a population approach, where you educate or provide intervention services for the whole population, and we move that curve over to the left and therefore reduce the number of people in that high risk. And it's represented here as well. We shift the whole population curve into a lower risk category. So by doing that, we actually lower the number of children, the number of parents, whatever issue we're dealing with in that high risk pointy end that needs treatment. So in conclusion, we know that children pass through predictable stages and transitions that may pose risks to mental health and well-being. These are predictable stages. I highlighted them before in infants, in toddlers, and in preschoolers. We know that parenting plays a key critical role in shaping children's well-being. Children and parents develop together. We sometimes forget parents. We know that children go through developmental stages that are predictable, but so do parents. They develop together. So parents play a key role. Parents aren't just consumers of services, but they're the key change agents. They're critical partners with us in promoting children's well-being. And that's, again, a big difference between adult mental health and children's mental health. And that's why adult approaches, the traditional approaches, will not work with children. We know that adult and child well-being is closely connected, and we require a different language, a language of support and encouragement and well-being, rather than a language of diagnosis and deficits and problems. For those of you interested in policy, I really want to share some of the work we've done in Australia. I was co-chair of a national children's mental health and wellbeing strategy that was finished about a year ago and is now being implemented. I think we're the only country in the world to have a national strategy of this kind by the federal government. Notice these focus areas. We haven't talked about tertiary care or more mental health. We started with family and community, because that's where we need to invest in resources, in parent literacy, in supporting parents. The service system is largely focused not on the tertiary care or hospitals or mental health institutions, but on childcare and maternal and child health nurses and pediatrics, education settings, and then evidence and evaluation. And there are 8 principles. It's the approach is child-centered, strengths-based. It's a universal system. It's not just focused on the pointy end. It's evidence-informed best practice and continuous quality evaluation. It's prevention-focused. We make sure that there's equity and access, so everybody has equal access, irrespective of their financial position. Early intervention is key, and it's needs-based and not diagnosis-driven. And this is the summary. In the last paragraph, I think, it proposes a number of actions that collectively represent a fundamental cultural shift in the way we think about mental health and wellbeing for children. A change in language that refers to a wellbeing continuum that supports early intervention, a change in status to give child mental health parity with physical health, a change to ensure access and equity, a change towards needs-based access to services, and importantly, a change in our collective understanding of the roles of families, communities, services, and educators. So you can see this is a major shift away from the way we've traditionally looked at mental health. So thank you very much. There's my email address.
Well, this is such an excellent and insightful presentation. So we thank very much Dr. Oberklein for doing this recording for us. We can learn a lot as well for the advancements done in Australia by the Australian government and with the support of these high-level researchers and professors. We also invite you to read the two blogs authored by Dr. Oberklein that are posted in the Health Systems for ECD website, and Zorit's already shared the link. Now, we are very honored to listen to a presentation by Ms. Evelina Borisova, the UNICEF Regional Advisor for Early Childhood Development at the Regional Office for Europe and Central Asia. Remember to write your questions or comments at the Q&A or chat box. Ms. Evelina, the floor is yours.
Thanks a lot, Alessandra, and I hope you can hear me as well.
Yes.
It's hard to follow such an insightful presentation by Dr. Oberklein, and I wish that he was with us because I think there would have been a lot of questions for him. But let me try my best now to kind of turn our attention a little bit from what I think he very clearly presented in terms of the shifts and the kind of the true transformation of the field in child well-being and mental health towards supporting parents, because I think we've already heard very clearly just how crucial it is to support parents. And I think at UNICEF, we've been thinking quite a bit for quite some time in kind of developing a comprehensive framework and approach for how we work with parents of young children. And I'm happy to share just a few reflections on our side that hopefully will fit nicely in the rest of the presentations that are forthcoming. You can go to the next slide. And this is just a reminder, I think we've heard it already beautifully of just how crucial parents are. I don't need to repeat it, but I do love the phrase on the screen, which is a tagline for a campaign that we've been having in June, that when a child is born, a parent is born too. And indeed, we often forget, as we've heard from previous speakers, that we're new to parenting, most of us, when we start this journey. And it's really important to remind ourselves that when we're working with parents, just as we're asking them to be nurturing, supportive, and really present for their children, many parents need the same type of support in order for them to provide it for their children. So it really is such an important aspect of thinking about parenting programs. So I hope we can anchor our discussion in this understanding and knowledge that parents are new to their role, many of them, especially first-time parents, and that every child is different. So even if you've been a parent before, you're always surprised with new challenges and obstacles along the way. You can move to the next slide. I think we've heard already from Dr. Oberklein, from previous opening speakers, that more than anything, children need responsive, stable, and nurturing caregivers. And these interactions are influenced by many factors, one of which I will argue in this presentation, and I think through the whole webinar, is parenting support. And we can define it in a little bit more, what we mean by parenting support and how to provide it, and what are the best kind of frameworks out there to think about parenting support programs. But it's not just parenting support programs, and I think it's something just to keep in mind in the back of our minds that even in the presence of very strong parenting support programs and services available for parents, there's many other factors that are truly playing in the background, and that is indeed parents' mental health, the stress that they may be experiencing due to vulnerabilities, poverty, insecurity, etc. Parents' understanding of their role and developmental needs, and their own experience of parenting. And I think these are truly significant factors to consider in the broader context of parenting programs that we're all working to support and foster. You can move on to the next slide. And it's really just to put into perspective the conversation we're having today around mental health and well-being of children and families, to share with you UNICEF's global framework on in this area, and really to kind of highlight that indeed the way that UNICEF looks at the relationship between children, families, communities, and the broader environment is through this lens of interconnectedness. And you can see very clearly that we have a strong outcome in our theory of change and the way we work on caregivers, precisely because there's a strong understanding that when we talk about child well-being and mental health, we can't talk about the child without talking about the caregiver. So this is already well reflected in our kind of global thinking and framing of the issues, and I think also in the programmatic approaches that we are now implementing across different sectors. Over to the next slide. So what do parents need? I mean, let's turn our attention now to really thinking about how do we support parents, and how at UNICEF we've been thinking about this kind of broader concept of parenting support. I really liked how Dr. Overklad talked about a broader concept of parenting support as well, and I think we're broadening it even more at UNICEF. From what we're experiencing and hearing and learning from our partners and work with parents, of course, parents need information. They need evidence-based and clear and information that they can trust, so they can build their knowledge, skills, and behaviors. They also need access to quality services to really support them in this journey of being a parent and going through the different challenges and obstacles that are along the way. Very importantly, to bolster and to really support their own mental health and well-being, and to give them a sense of community that they're not alone in all of these challenges, and there is a safety net behind them, that there's other parents who they can speak to, professionals and service providers that can be there for them. We're broadening the concept of parenting support even more, going beyond parenting programs into supportive environments. Why? Because we have seen very clearly that programs alone are also not enough. When we think about policies such as parental leave, breastfeeding breaks, childcare, and other family-friendly policies, those are just as important to really make sure that they can enable parents to access services and get the support that they can need. So these kind of three key elements are really coming close together, and how we're envisioning the framing and the support that governments and civil society can be looking to provide for parents. And what is our vision? You can move on to the next slide. Well, I think our vision is ambitious. I think from our perspective, and I hope that it's a shared vision, we want to see every parent, regardless of any background circumstances, has access to comprehensive package of parenting support in the most crucial years of a child's life, and that this support really is empowering them to nurture their child's potential and to make sure that they have the services and the support to make the journey possible. In a nutshell, I think what we would like to see is really a shift to parenting support being seen as optional in policies and programs, to being seen as non-negotiable and universal. And I think this is something that is achievable, and we're already seeing a big shift in how governments and partners are looking at parents in a much more systematic and thoughtful way. I'll talk in a little bit about the framing that we're putting around universal progressive support to parents. But I think I hope we're together in this journey of looking to see how we can make universal support to parents available to everyone, and then of course providing more targeted support to vulnerable families who often need more intense and more comprehensive set of services and support. In our vision, we're also looking to harness the power of digital innovations. We'll talk in a minute about why that's important and what are the possibilities with that. I think we have a fantastic presentation from colleagues from Uzbekistan who'll touch on that later. And as I mentioned, we're also looking for ways to support governments to look at their national plans and policies through a different lens, through the lens of how parents and children come together in those policies. Some of the time we see policies that are very powerful in bringing that dyad and the family together, but a lot of times they're siloed for how we see parents are addressed in policies versus children. So looking ahead, I think this is something really exciting in how we foresee the work around supporting parents in these early years. Can move on to the next slide, and I'm going quickly because I know we have exciting presentations after us. I just want to spend a minute on why parenting support programs. There's quite a few of us online, and I'm sure we're coming from different fields and maybe with different knowledge around why parenting programs matter and how they work. And the good thing is that we actually have very strong evidence on that, that indeed parenting programs are game-changing. You see that the evidence over the last 20 years has grown significantly, both in terms of trials and kind of effectiveness studies around parenting programs. Over 435 randomized controlled trials across 65 countries, and really conclusive evidence that you can see on the side that indeed parenting support programs are not only beneficial for the outcomes that I think we could predict they'll be good on in terms of child development and cognitive, language, social, emotional skills, but also actually supporting parental well-being as well as children's trajectories for well-being and mental health. Conclusively effective across the different types of families and vulnerabilities and across low, middle, and high-income countries in reducing child maltreatment, harsh parenting, etc. So the evidence is with us on this, and I think that's really a great starting point for the rest of the conversation in terms of then how do we scale up what we know from the evidence and really take it to the next level in how governments and partners are considering the framing and support for parents to make it available to all. And now you can move to the next slide. I hope many of you have also seen this. I think we've presented this in the past, or perhaps you have seen a version of this. At UNICEF, we look at the kind of the parenting support in a pyramid. We often talk about it as a parenting support pyramid. Why? Because it really kind of emphasizes this universal progressive approach to supporting parents. You may hear us speak about the fact that every parent needs support. That's the universal layer of the pyramid, but some parents need all the support they can get, and that's the upper part of the pyramid. I think it's a very useful framing to think about the different needs and the different potential different services and entry points that exist to reach parents, and the value of looking across these layers when we consider a comprehensive approach to supporting parents. I think depending on who we're working with and in what vulnerable circumstances parents are, we may find ourselves in different layers of this pyramid. But I hope that nationally, and I think this is a conversation we're very passionate about, we're looking at a mapping of parenting programs that may be available across these layers of vulnerability and need, and an ability to be able to step back and look at gaps and look at ways that these policies need to be improved and strengthened further to make sure that indeed universal layers of support are available to all parents and are functional and are accessible, while at the same time very targeted and intensive support is also available, is costed, and there's professionals that are able to provide it. Now let me spend just a minute on each layer, and I won't even go through all the layers, but I think this is actually quite exciting and important to think about what is in each one of these kind of broader layers of programming. If we move on to the next slide, and the good thing is that I think we'll hear about some of these programs shortly, so I'm really just paving the way to colleagues who will be speaking after me. Well, on the bottom of the pyramid is really broad information sharing channels and programming mechanisms that exist, and in different countries those are different. I think in this region, given the growing number of parents with access we're seeing a huge potential in mobile applications, just the one you'll hear about later, Bebo, as well as other hubs, parenting websites, and social media messaging and campaigns that we have being extremely successful during COVID in really providing basic but really important evidence, tips, ideas, and support parents that can be available at their fingertips now much more than ever before. So strengthening this I wouldn't even call it universal, but it's truly population-wide level of information and support is something that we see as a huge opportunity for this region and beyond. If you go to the next slide, here we're looking into the integration of parenting support programs into routine services. This is something that I think is very clear to this initiative, Health Systems for Early Childhood Development, because indeed, as we have spoken in previous webinars, health platforms are amazing entry point for integrating parenting support and for making that non-negotiable part of how pediatricians and health workers support and work with parents of young children. Here we've talked about facility-based parental counseling, but very importantly, home visiting programs. And I think we'll have the chance to hear about that today as well. Home visiting programs are a fantastic opportunity to be in close contact with parents, to support them in their journey, but as well as to support the children. So that's just one example. I think in the social welfare platforms, we have an opportunity to reach sometimes the most vulnerable families as well. And they have a huge role to play in preventing family separation and institutionalization, as well as supporting foster and adoption parents to master parenting skills, to integrate positive parenting programs, and to minimize and address some of the risks of violent and child disciplining. Of course, there's the education platforms. I don't want to underestimate how much we can do also through preschool educators, as we have heard from Professor Oberkleid and colleagues before me, but actually putting all these platforms together and looking across them, how cohesively and comprehensively are we targeting and reaching parents of young children, and how are we complementing the support and available services available across these platforms, is where I think we can have truly tremendous impact of being able to position the work across these sectors in a complementary manner, and to make these and to make services available across these platforms work. You can move on to the next slide. I'm skipping a layer just a little bit because I think the link then from integrating parenting programs and routine services, moving into the more focused and targeted group-based sessions, targeted programs, whether that be targeted programs specific to discipline or fathers or first-time parents. I mean, here we're going into a little bit smaller portion of the population for which these more targeted and intensive programs would be relevant, going all the way to the top of the pyramid, where this is really the families with children with the most complex needs, for whom we know we require a more multi-sectoral support mechanisms, where in this case is good referrals between sectors, understanding of what is the role and resources of each sector that needs to be put in place becomes really crucial. A good example for that is early childhood intervention services, of which we've spoken in prior webinars, and I hope we have a chance to talk about again. They're a really an excellent example of really working with families in the most, in a way, in the most important years of a child's life, where we can not only prevent, but also put children on a better track for success, and bringing together professionals across sectors in a different kind of model of multi-sectoral and multi-dimensional model at the homes of families. And I think this represents, again, perhaps a small percentage of families who would need that support, but very importantly, to look at it through the needs and through the intensity of support that they would need. Across this pyramid, and I will just pause here in 1 minute more to step back a little bit. These programs and parenting program examples that I've given, they don't stand in isolation of each other. I think this is where the vision of a true framework for parenting support in the early years is really comes to life, because not only we want sectors to talk to each other and to look at how we're integrating parenting support across sectors, but we also want these pyramid levels to speak to one another and to create coherence and really truly a comprehensive support based on the need from universal to more progressive and more intensive needs that would be needed. against this pyramid in the backdrop is the policy environment. This is where we come back to a point that I made earlier, where enabling policies are truly important, including social benefits and social protection schemes that allow for parents to access these services and to truly be, for those services to be effective. So when we think about parenting support, I hope we can keep not only the parenting programs in mind, but also what's behind these programs vis-a-vis costs, resources, finance, and coordination across ministries and partners that need to come together, all with the vision of supporting parents against the principles that I think we've heard already. Parents are partners in this journey. They bring tremendous amount of passion, information, care, and knowledge about their children and themselves and the communities, and making the best with them and with the resources available in their communities is perhaps our best bet. Let me pause here and thank you very much for giving us a chance to share the way that UNICEF is thinking about this issue. And I hope the next presentations, I think, will fit nicely into this pyramid. Thanks a lot.
Thank you very much, Dr. Evelina, for this very interesting overview about UNICEF's universal and integrated approach of parenting support. I'm sure it's very, this is very useful for our participants. So to keep our time, our schedule, so now we will learn about two concrete examples of parenting resources that can support the mental health and well-being of parents and young children. One of the resources is the Bebo app. So I invite Dr. Alessandra Jovic, the Early Childhood Development Specialist at the UNICEF ECARO office, for presenting a brief context, and just after her, we will have a recorded presentation by Dr. Nilufar Akhmedova, PhD, Doctor of Science, Associate Professor at the Tashkent Pediatric Medical Institute. And Dr. Nilufar will explain how the Bebo app has been used in Uzbekistan. And at the end of the webinar, hopefully we will have a short question and answer session for all the presenters. So Dr. Alexandra, the floor is yours.
Thanks a lot, Alessandra, and I hope that you can see my screen. I've started sharing.
Yes.
In the interest of time, and I'm very glad to be in the opportunity to say a few words about Bebo. I hope that many of you have already heard about it. It is the digital parenting mobile application that has a particular role. I'm sorry, trying to move my slides, but it doesn't help. That is developed to support parents of children aged 0 to 6 with high quality evidence, information, and interactive tools, and help these parents who we heard struggle on a daily basis with a lot of decisions that have to make on their children to make the ones that will be the best for their child's health and development. The content of the app is aligned with the nurturing care framework domains, and it covers all 5 domains, plus the one that relates to parental well-being. You will see health, responsive parenting, learning, protection and safety, nutrition, and of course, information for parents on how to take care of their own well-being and mental health. This is an app that also provides interactive tools. So these interactive tools will help them monitor child development on a daily basis, as well as support growth, to track health visits and immunization schedules. And all of these tools are really aligned to the child's age and gender and provide quick guidance and information that are aligned with the data that parents enter. The app also offers more than 300 games that are linked with the child developmental milestones and help parents, encourage them to engage in behaviors and in activities with children that will stimulate their development and help build that important bond between children and parents. Then finally, there is a rich library of high quality short articles that respond to the questions that through evidence and through experience we have learned are the most interested for parents of different ages. Again, these advice categories are also linked to the appropriate age of the child, and the parent can enter more than one child and continue tracking. In the period of the last year and a half, Bebo has expanded over 14 countries. Today, we have more than 840,000 users or downloads, and it is available in the local languages in each of these countries, in 14 international languages, but 24 language variations across countries that share 2 languages. Bebo is special because of a number of reasons, and they start with the fact that it is developed based on a human-centered design and localized content, meaning that starting from the master content that is provided within Bebo Rich repository, every country is translating, adapting, and adding content that suits their own local context and needs. Bebo is not collecting any personal data. So everything that parents enter remains stored only on their mobile devices, and we are not collecting or processing this data centrally. Respecting the fact that still in our region we have territories in which internet connectivity is not strong, Bebo can operate fully offline, having only one first instance of internet connectivity when it is downloaded, and all the interactive tools can also support parents in offline mode. You will also hear that Bebo is not developed to be an isolated digital solution that, that only serves parents on their mobile phones. Bebo is rather integrated into the overall programming across countries, as you will hear from the wonderful example of Uzbekistan. It is a tool that helps professionals that are in contact with parents of young children to, again, find advice, to build cohesive language, to suggest what are the things and activities that they could engage in. Bebo really supports outreach, both online and offline activities, and it is becoming a digital public good, meaning that the whole technology package that is in Bebo is open source, meaning that it is free of charge, that any other country can start using it. It is free of charge for the end users and doesn't have any commercials inside. And I think that we are moving to the next part and to Dr. Nilufar, whose presentation will be much more interesting, showing how was Bebo implemented in Uzbekistan in collaboration between UNICEF, national government, ministries of health, and professionals and parents. Over to you.
Thank you so much, Dr. Alexandra, and now we will watch the presentation from Uzbekistan, and it's incredible, when UNICEF is involved, so the app is already in 14 countries. So let's learn from Professor Nilufar.
Dear colleagues and participants, allow me to present the experience of Uzbekistan in introducing the Bebo. Every child needs nurturing care, good health, optimal nutrition, stimulating and safe environment, and support during early learning. According to 2022 data, 46% aged 3 to 4 in Uzbekistan participate in early learning programs, and 78% of children aged 2 to 4 are engaged with 4 or more types of activity with their caregivers. However, for the purpose of providing the best start for children, all children need additional support, especially the vulnerable children that face additional issues such as poverty, disability, social isolation. Why Bebo? Bebo is an app that supports responsive and nurturing parenting. Its objective is to provide comprehensive information and Конечно, информации очень
The
много, но Беба
information
предоставляет
in
именно научно
user-friendly
обоснованную
and
информацию, а также содержит, является
pocket-care
полезным
format. It
интерактивным
also provides
инструментом, который
evidence-based
помогает
information
в вопросах
and is a
воспитания
source of
и
useful
способствует
interactive
укреплению
toolkit
здоровья и
that
развития детей.
helps
По данным
helps the
индикаторов
children
уже
development parents
Узбекистан
monitor their children
достиг
development.
некоторых результатов.
We have a certain
Это,
number
конечно,
of
85%
indicators,
уже подключенных пользователей,
85% of connected
78%
users,
людей, которые
78% of
возвращающихся пользователей.
returning
Среднее
users.
кумулятивное время
The
составляет
average
37
cumulative
минут,
time
а также
with the app is 37
процент
minutes.
пользователей, читающих
Also, the
статьи,
percent of
использующих игры и
users
отслеживающие
who
этапы
read
развития детей,
articles.
конечно, преобладает по сравнению с остальными странами.
Of course, we have higher figures than the rest of the countries compared
Узбекистан
to,
стал первой страной,
as per the
запустившей
number
Бибо.
of
Это было
users who
конец
interact with all elements of
ноября
Babel. We
2021
became the
года.
first
Однако
country in our
усилия по
region who launched
продвижению
Babel. That was done in
приложения, а
November
также по
2021. But
интеграции
of course,
программ
the
были
efforts to
минимальными с
deploy the
момента
app
запуска
have
до
been
октября
staggered.
2022
They have
года.
been
Это нашло
continuous
свое
from the
отражение
launch
в
until now.
относительно небольшом количестве новых загрузок, а также в
And
очень
that meant
высоких
that
показателях
originally
удаления.
at the launch we
Впоследствии
had a
подход
large
был
number
немножко
of
изменен и
downloads, but later
сосредоточился
to
на
support
поставщиках услуг.
the
И начиная с
take
сентября
up,
2022 года при
we
поддержке ЮНИСЕФ
conducted targeted assistance with
началась
UNICEF
реализация
support
амбициозной программы по продвижению БИБа
to
через
promote
работников
Babel
первичного
through
звена,
the
родильных
primary
домов, а
healthcare
также
workers
детских
in
дошкольных
maternity
учреждений
wards
в
and also
пилотных
at
регионах. Это в
preschool
городе
facilities
Ташкенте и
in pilot
Ферганской
regions in
области.
Tashkent and
Начиная
in
с
Fergana region.
апреля настоящего
And
года
then,
уже
starting
идет
from April
расширение
to
продвижения БИБа
2023,
в 6
we
регионах.
have
Это
been
Ташкентской,
promoting
Сырдарьинской, Андижанской, Самаркандской
Babel
и
in Tashkent,
Джизанской
Sirdarya,
областях
Andijan,
с помощью
Samarkand,
этих
Namagand, and
работников
Jizayka
МСФ и родильных
districts
домов, а
through
также детских
the
дошкольных
primary
образовательных
healthcare workers
учреждений.
and
На этом
prenatal
слайде
and natal
представлено
facilities.
покрытие
In the
регионов. Мы
slide,
охватили
you
уже весь
can
город
see
Ташкент,
the
мы
coverage.
охватили
We
центральные
have covered Tashkent, we
регионы и
have covered
восточные
the
регионы
central
области, а
and
также
eastern regions of the
охватили
country,
часть
and have also
центрально-восточного региона, это
covered
Самаркандская
5
область.
districts of Samarkand region.
Нами была проведена
We
серия
have
каскадных
conducted a
тренингов
series
при
of
поддержке
cascade
странового
trainings
офиса ЮНИСЕФ.
with
Были
support of our
подготовлены
UNICEF country
тренера
office. We
административных
trained
сотрудников, врачей,
trainers
медицинских сестер
from the
первичного
number of
звена, а
healthcare
также
professionals
родильных
and
домов, которые
nurses from
непосредственно затем
hospitals,
должны были
prenatal
обучить своих
clinics,
коллег,
maternity wards, who were
те
later
уже
expected to
непосредственно
provide
занимались
training
с
to their
родителями и опекунами.
respective peers, work further with parents and
И на
caregivers.
этом слайде представлено
In this
количество
slide,
обученных
you see
тренеров в
the
этих
number
6
of people
регионах.
whom we trained from
Были
6
обучены
regions of
областные
the
и
country.
региональные главные специалисты, это
We
главная
trained
медсестра,
chief
главный
physicians,
педиатр,
chief
главный
nurses, chief
акушер-гинеколог.
pediatricians.
Были обучены медицинские работники родильных домов,
We
многопрофильных
have trained
центральных поликлиников,
professionals
а также
from the
медработников
maternity wards
семейных поликлиник
and
и
also
семейных врачебных
healthcare
пунктов.
workers
Всего
from the
было
polyclinics
обучено
and premedical
1920
stations.
работников.
All in all,
Кроме
it's
того, в
1,920
системе
people.
образования
Additionally,
тоже
we have
в
also
Ташкентской
covered
и
the
Ферганской
educational
областях
system
были
with
подготовлены
trainings.
тренера из
We
директоров,
have trained
методистов,
1,550
воспитателей и
people
медицинских сестер,
from
которые непосредственно
a number
работают в
of school
детских
principal,
дошкольных
methodological support
учреждениях, и
specialists,
1550
preschool
тренеров.
teachers, and nurses.
Это вот эпизоды
These are the
проведенных
visuals from
тренингов
the
и
trainings that we
мониторингов
had.
в учреждениях первичного звена здравоохранения. На следующем слайде это
In this
внедрение уже
slide,
его
you see
детских
how
дошкольных
BEBA was deployed
учреждениях. В
across
городе
the
Ташкенте
preschool
было обучено
facilities
375
in Tashkent
тренеров, в Ташкентской
and in
области
Tashkent region
655,
and
в
in
Ферганской области
Fergana region,
855,
375
которые уже
people in Tashkent,
непосредственно работали с
655 in Tashkent
родителями и
region, and
опекунами.
885 people in Fergana
Ну,
region.
извлеченными
A
уроками
few lessons
стали,
learned.
опыт Узбекистана показал, что
The
использование
experience
разных
of
каналов для продвижения
Uzbekistan
социальных медиа не
confirmed
всегда достаточно
that
дает
it's
успеха,
not always
а продвижение через поставщиков
useful
услуг,
and
понимание и
is not the
того,
only
что
condition
данные
to
приложения
promote
полезны
BEBA
для их
across
работы
social
и
media,
профессионального роста,
promoting
также для
through
общения с
service providers
родителями.
and understanding and
Это дает,
generating their
конечно,
awareness that
значительный
this app
успех.
is useful
Кроме
for
этого,
their
еще
work
приверженность
is the precondition for
национальному
success.
уровню,
Also,
тесные
commitment
партнерские
at the national
взаимоотношения
level,
ЮНИСЕФ,
close
Министерства
partnership
здравоохранения
relations
и
with UNICEF,
Министерства
Ministry of
дошкольного
Education,
and healthcare, and the presence of strong national partners. A few follow-up steps should be constant monitoring on the part of the Ministry of Healthcare, constant exchange of information and data between UNICEF and national partners, also for achievement of the target indicators, sources including professional networks, mass media, social media, to further promote the app. To promote using the app through medical workers and preschool workers for daily use, while constantly working to improve and reach the content, including by means of multimedia pieces of content. We're also discussing with the mobile operators of providing free of charge mobile traffic, dedicated traffic for that particular app, because our monitoring made us aware that in certain areas of the country, we have quality issues and stability issues in terms of mobile internet access. Thank you.
Well, first of all, we apologize for the, but we are lucky that we have Dr. Nilufar here with us. So we have one more presentation. My suggestion is that we cover the last presentation, and then at the end we will open for questions. So please post your questions in the chat or in the Q&A box, and Dr. Nilufar, I'm sure will be happy to answer them. And thank you so much. I was really impressed by the numbers of the trainees, right? More than 3,000 people in total from combining the health, the education sector. So let's move on to our final presentation. So our next presenter is Ms. Biljana Stefanovic. She's a nurse and the head of the home visiting service at the primary health center in Kruševac city in Serbia. She will present the caring for the caregiver package. So she will present it in Serbian, thus choose your language in the interpretation box. Ms. Biljana, the floor is yours.
Thank you very much. I would like to welcome you all. I still have no permission for the video, but I will tell you about my experiences in this program and how we use it in Serbia. This is the program that gives us evidence on the importance of mental health of parents, caregivers, and support and skills that we can apply through our work to support parents. Since we know that parents have significant importance for the life and development of their child, it is very important that, first of all, the parent is well so that the child can be well. In order to succeed in this, the parent has to have a motivation, knowledge, support to take care of themselves and support adequate care to their child. In the previous few years, we have changed our work a bit in Serbia. We pay more attention now to emotional needs of parents and recognition of their needs and how to provide this support to them, because every parent goes through a stressful situation through their parenthood, and our goal is to recognize their needs and together with them learn those skills. We have worked on in the fields of immunization, hygiene, care, nutrition, and now we have added overcoming and coping with stressful situations through parenthood. This training meant a lot for me because it was interactive. We had this supervision support. There were 20 colleagues involved. We cooperated. we mostly presented our case studies analysis. We had role plays occasionally, supervisory sessions, and we interconnected and supported each other through these trainings. So now we have lots more self-confidence entering the family. As for the parents, which skill they adopted, starting from the prenatal interview that we introduced in our work. From the very beginning, we connected with a pregnant woman, where we first work on creating a parental alliance, how important it is, how can parents recognize and name their feelings and talk about them, to agree between themselves how much time they will have for themselves during this time, so that they map the resources in their close family and as well as in their community where they can find support if needed. This training lasted for 3 days, 25 hours. In the first phase, we had 10 master trainers with 50 professionals trained from the health sector, home visiting nurses, then we had second phase where 20 master trainers were trained from 20 locations, 20 different primary healthcare centers where we shared our experiences, and I participated in this, so that we can transfer the knowledge to additional 80 trainers until the end of 2023, and they will sensitize and educate 100 more visiting nurses. The plan is to have all 1,200 home visiting nurses equipped with these skills until 2024. I apologize for the previous slide. Those were cards adopted to us, and they are in Serbian language. And we have a text about coping stress. Those are information cards. They talk about general issues, and there are cards for counseling on how to cope with the stress, so that the parents can recognize their feelings, their emotions. That's the first step in overcoming stress. Then one of the techniques, which is small but very important, is the breathing technique, and we implement it now in every family as a prevention of stress. All home visiting nurses in Serbia got this professional methodological guidance, where the main component is support to mental health as a key component in the work of home visiting nurses. And it was approved by a special group of the Ministry of Health. Then this professional methodological guidance for strengthening these skills through a regular work is planned to be created. And we have a training package that has been accredited in the health sector. We are working on creating an online module, and Academy of Applied Studies, where we are trained to be home visiting nurses, is working on integration of these skills into the academic curricula. What are the lessons learned? I will start with one sentence that one of the mothers said: "Thank you for being here for me, to listen to me. It meant a lot." Sometimes a little is enough for the parent, so that we can eliminate their concern and to support them. We are creating trust from the very beginning, trust with the families. We are always available. Parents know about our regular visits. We agree with them. We never judge families or parents. We are always there to get their trust, and we do not promise anything that we cannot fulfill or go through together with them. As regards these studies that have been implemented in Serbia, we know that families with greater risk have adopted these skills in lesser scope, but we have a wider social support network for them. Parents with lesser risks have adopted these skills starting from parental alliance, responsive parenting, and they can recognize signals of their child and respond to them through daily routines. They read with a child, they can play with a child, they talk to the child from the very birth. At the beginning, they asked, how can I talk with a baby when the baby doesn't know anything? But after these educations and trainings where we told them that if you talk with the child when it's in the belly already, the child has better chances of better socializing. So responding to the needs of the child and talking as much as possible to the child is beneficial for both parents and children. What else have they learned about overcoming stress? To have a support person, either in their close family or in wider family through grandparents or in local community, in health institutions, social care institutions, or some parenting associations. As for us, the professional, people from practice, frontline workers, we have gained a lot of self-confidence and new skills. We are still learning, and I can thank our association of home visiting nurses that exists in Serbia, which is growing bigger and bigger. And I hope all the nurses will be members very soon, because we have this professional support network, which is very important for our further work, so that we can empower ourselves, because we also have stress during our work. This supportive supervision from our colleague is very important. For example, in my town, in Kruševac, there are 19 of us. We have about 22,000 inhabitants that we reach. We have once a month supervision sessions where we all present case studies. One colleague presents how she worked with a family, and we support her if she had a stressful situation. We facilitate this for her, and it is easier to go through such situations. This supervision has been going on for a year in my hometown, and there is a great progress that can be identified. It is much easier for us to work. Our self-confidence is built a lot. So this is all from me. I hope you will find it interesting. Thank you.
Indeed, very, very much. Thank you, Ms. Biljana, for your excellent and informative presentation. We do have, yes, a few questions, and we would like to address them. However, we don't have time to do it right now. However, you can, if you subscribe to the Health Systems for ECD newsletter, we will make sure to forward your question to the specific presenter, and we will get back to you. However, I also want to invite each of the presenters, starting with Dr. Evelina, to share with us one final takeaway. And so, Evelina, Dr. Akhemodova, and then Alexandra and Biljana, please. Okay, no problem. So you can start, please. Yeah.
So I can start to make up for that and then hand over, or we can just to say that the message to me is really unique, that the response to many problems really lies in supporting both children and families, and in a very individual and trustful way. There was one of the questions that colleagues asked: what if parents don't collaborate? And I think Biljana nicely explained that the key of the intervention of the caring for the caregiver is in building this trustful relationship that requires time and skills and patience. But the whole paradigm shift is in, building the partnership with parents, in which we are just one of the elements of support and helping them support their children the best they can, because there is a capacity and ability and the strength within each parent to do the best for their own child. I hope as well that you will look at the links that we have left in the chat and learn more about all the different resources, including Bebo. Over, Alessandra, to you. And Biljana, it was amazing. Dr. Nilufar, it was amazing. Thank you so much for sharing this experience from practice, and we can share also your contact so that participants can exchange with you directly and get more info.
May I pass to Dr. Nilufar for your final comments? A brief takeaway, please.
Я бы хотела поблагодарить всех докладчиков.
I would like to thank all the presenters for the interesting and insightful presentation. I have downloaded the materials that were posted in chat. I've saved all the links. I'm sure that all parents need support for early development of the children, for the best trajectory and untapping the potential of their children, for their health and security, for their well-being. The Bebo app that I presented today served a good solution for the parents of our country, and I'm sure that we need to take it further, that we need to scale it up across other countries, across other regions. It was a good thing that Bebo was written in an easy to understand language, and I'm sure that we will see better uptake, because it was important to indeed engage with the service providers for its promotion. I wish all the best to all of you. Thank you for making me a part of this event.
Thank you very much, Dr. Nilufar. And then Biljana, please.
Dr. Nilufar. Biljana, molim sada vas za komentar.
Would you like to say,
Biljana, da li biste
one takeaway, one final takeaway?
Želim da...
Eto, toliko od mene.
Thank you so much.
Hvala vam svima.
Now I invite Dr. Aigul Kutumoratova. She is the technical office, primary health care, child and adolescent health and development at the WHO regional office for Europe for the closing remarks.
Svetske zdravstvene organizacije za Evropu. Hvala, Aleksandra. Što ste podelili, hvala svim učesnicima što ste podelili svoje iskustva i inspirativne prezentacije. Za kraj
provide responsive care, hampering the development of secure attachment and relationship between the infant and parents. I want to reinforce here that postpartum depression is a risk factor for mother and child and frequently is overlooked and or underestimated. Therefore, maternal mental health should be assessed during pregnancy and the postnatal period, but also during the assessment of child's development. So what we can do to advance child development, what we heard from today. First of all, universal approach. Parents of all children need an access to health services that provide them with reliable information, that offer guidance that gives them confidence in their role as parents. So in this case, universal approach is efficient because it focuses on promotion and prevention. Well-informed parents can provide good nurturing care and respond to child needs more effectively. They are able to make informed decisions on care seeking. They can provide informed consent for treatment if needed, and make use of timely vaccination. Second, I would like to also underline from today's webinar is the importance of health literacy. The caregivers are widely exposed to unreliable and non-evidence-based resources, especially on the internet. To make informed decisions, parents need health and parenting literacy, such as knowledge on child development, on access to services, and parental rights, in particular mental health literacy, and signposting towards credible online and community resources. So what do we have? Ready for use intervention packages. And today we have been introduced to the Bebo mobile application and training model caring for caregivers. They use in countries, they are very instrumental. They provide guidance on how to ensure responsive care, how to make best for your child, increase positive parenting behaviors, and decrease disruptive child behavior and violence in the family. What is impressive coverage with the Bebo application in Uzbekistan and rolling up with trainings in Serbia. Bravo. Who can deliver counseling advice to parents and where? I think it's, of course, obviously health professionals, especially in primary health care. They play an important role. And home visitors are central because of their unique position and direct outreach to families. They can support families with information and practical assistance. So apart of them, we have good examples in countries of family PHC, primary health care, multidisciplinary teams that includes GPs, home visiting nurses, social workers, and psychologists, who also can support parents' well-being, mental health, and also deliver targeted services and care in a more comprehensive way to those who are in a difficult life situations. I would like also to underline a statement that parenting support means focusing on the child rather than on parenting. Last but not least, we need to inform and communicate with parents using language of support, encouragement, avoiding any stigma, focusing on child and building on parent strengths. So definitely we can here address stigma, which is especially sensitive when it comes to mental health of child or parent. WHO, UNICEF, and ISA provide technical support for adaptation of effective intervention by countries related to parenting and nurturing care. We also support country efforts in development and implementation of national policies on nurturing care and ECD services. We are here to support you, and this website is to support you. I want to thank ISA team for maintaining this great learning platform for countries in Europe and Central Asia and beyond. UNICEF regional office for the strong collaboration and support, and technical advisory group for their guidance and expertise. Many thanks to all the participants who joined us today. Goodbye, all the best, and until next meeting on this knowledge platform that keeps us updated on new evidence-based resources, but also facilitates exchange of good country practices. Thank you.